Welcome to CarePOD, a safe place to educate, inspire, and renew the caregiver. Listen in with our host, Dr. Kipley Bell, as she interviews different experts along the caregiving journey.
So I'm at this unique stage in my career where I am a mentor. You know, I'm 22 years in my career, and I have fallen on my face a few times. I've been a thought leader on other times, and I've learned in between. And so now I have the ability to mentor those coming up behind me. And so this podcast episode is really important to me. This was my first mentor in medicine, Dr. Warren A. Katz, rheumatologist, really took me under his wing in clinical practice. And you'll see from our conversation just the importance of patient care, patient interactions, and being human and normal, right? And understanding how disease, and specifically in this podcast, how arthritis can affect the way in which patients have an outlook on their own care and perspective of their wellness. So I am really honored to sit with my favorite doctor of all time, the person who has literally crafted the trajectory of my medical career, either verbally or non-verbally. And we often joke that we're just in this love affair with one another because I have such utmost honor and respect for him. And I bless the day that God had brought him into my life. And so without further ado and without further tears, I welcome to the CarePOD, Dr. Warren Katz. Thank you so much for joining us.
Oh, of course. And I think the operative word is one another. Okay. It's bi-directional. So I am absolutely delighted to be here. And I will say, too, that my wife says that there's never been a microphone that I've been able to pass by. So here I am.
Well, thank you so much. So just a little background for our audience. I met Dr. Warren Katz. He was my first literal entree into my medical career path as his direct physician assistant in rheumatology. Taught me everything I know about rheumatology, created a joy and a love for this genre of medicine, and really just learned some very early lessons that I think carry me to today. And it's ironic that it's National Teachers Week, and I'm here sitting with my mentor in medicine. So before we kind of go in, primarily I wanted to bring you in because there's a lot of caregivers, a lot of older adults that struggle with arthritis, struggle with how to manage even a person with arthritis, their ergonomics, their day-to-day. But before going into that, I wanted to basically, I always ask my guests their why. What brought you into this specialty of medicine, and where you think the future is?
Well, the first the question is really easy. And I got into rheumatology strictly by accident, serendipity, as so many things and even good things in life are. I had no interest in being a rheumatologist. And when I was in medical school, I had worked up two patients with rheumatoid arthritis who frankly were absolutely miserable people, miserable because they had such severe ongoing pain, ongoing disability, and miserable because their personalities took on the same look as their disease. And I didn't realize it at the time because I was, a novice medical student, but those patients were that way because they were terribly mismanaged. Their doctor did not take care of them properly, and I won't go into detail on that unless you want me to. So now cut forward a few years when I had to make a decision as to what I wanted to do. And one of the subspecialties, I'm an internist first and then a rheumatologist, but one of the subspecialties of medicine that I knew relatively little about was kidney diseases, which also nephrologists take care of kidney diseases, but they also take care of patients with fluid and electrolyte problems, as you are well aware. And it turns out that one of the world's experts were at the institution that I was at, the New England Medical Center. And I wanted to have a fellowship in that disease. And I got a call from the head of the program, and they said, Warren, I'm really sorry, you were our first choice, but one of the previous fellows decided to stay on to continue his research for a year, and I just don't have enough money. And so one of the people that I went to for a letter of recommendation was a rheumatologist. And when I told him what happened, he said, well, why don't you go into rheumatology? And my first answer was, thinking of those two patients, hell no. Well, one thing led to another. And he said, why don't you come over and take a look at our program and so forth. And the rest is really history. I fell in love with the specialty, and I like challenges, and it's a very challenging field. I liked the head of the program, whom, by the way, after more than 50 years, I am still in regular contact with. There's no, like you are with me and me with you, the same issue with my mentor, and I have tremendous respect for him, not only as a physician, but an individual. And
I love that.
Awful lot about it. So
I
that's
love that.
a reason why I went into rheumatology. The future of rheumatology, frankly, Kipley, it can be another podcast.
Mm.
The real answer is I don't know. There's a tremendous shortage of rheumatologists, and as such, as in many other fields where there are shortages of physicians, we are going to have to depend on technology. And while I do not think, and as you know, there's a big debate about artificial intelligence and what role that's going to play in general, and of course, what role it's going to play in medicine. And I do think it will play a role, an important role, but it's not going to replace people. It's going to assist the doctor, the real doctor, in a way that will be very, very substantial. So that's really the bottom line. I think that in rheumatology, as in all fields, there's just going to be tremendous changes taking place, and for the benefit. Already, we have such wonderful drugs to take care of patients with arthritis. Rheumatoid arthritis, psoriatic arthritis being two of the common models. Most older people do have osteoarthritis, wear and tear arthritis. And there's tremendous research going on, but we still don't have good drugs, as you well know.
Absolutely.
Yep, I'm sorry. And they are definitely in the pipeline. And the technology that some people are against, that very technology is going to be the technology that's going to help develop those new drugs, and therefore give people less pain and more ability.
Absolutely. So there's a few things you said there that I thought were really poignant in terms of the misery of the way the disease presents itself. And, this kind of collective misery of, providers, clinicians being overwhelmed with patient volumes and patient tasks and the perfect storm of the patient's misery because of their disease state. What do you think we're doing well, and what do you think we can improve on, as far as your note to those coming behind you?
Yeah, well, I think we are doing well in terms of the advancements that to date have taken place in rheumatology. Let me just back up 1 minute. Rheumatology, and maybe specialists in all fields will say that, but I'm only talking about rheumatology now. Rheumatology consists 99% of really caring people, not just doctors, but doctors who really care for their patients and feel for the patients and have compassion and understanding and the need for care. There are exceptions, to be sure, but I think compassion is really important. And compassion is the catalyst, the enzyme, if you will, that makes all the other medications, physical therapy, also to treatments, just be better. So that's so the fields of rheumatology since I've been in it has really evolved in that way. And it's a very, very rare, I'm happy to say, and I still, to this day, come in contact on a regular basis with lots of rheumatologists. And and it's just amazing how you can just feel when they're discussing a patient, not only what can we do from this patient in terms of medication, but in terms of the non-pharmacologic management, if you will. How can you make patients feel better? And I think we've become more and more skilled. Is there room for improvement? Absolutely.
Yeah. And I think that that's probably what has bonded us the most, is the compassion and heart for people. That that is the art of medicine. So I think that's so important for our audience to pick up on, to hear you say that, you're meeting with a collective of specialists that still have a heart to make people well, because we have this narrative on our profession that, doctors don't care, we don't listen, and, we're brushing people off. And as you well know, there are that cohort of people, but in all sectors of society. But I think to hear that, sitting with your colleagues, that, people, your colleagues and specialists still do want to make people well, is important. So what are the tips that you would give caregivers on accommodating those with arthritis? Because oftentimes, arthritis, some forms, or the most common form, are pain that you can't visualize per se, hence that misery and illness that you spoke to earlier. What are the tips that you would give to families and caregivers in those supporting patients with arthritis?
Well, number one, just like it's important for physicians and other healthcare providers to give patients compassion, it's doubly important for family members and friends and so forth to recognize what the patient is saying. And when they have pain, you can't say, "Oh, well, you don't look like you're in pain," or "How bad can the pain be?" There was a French surgeon in the 1930s. His name was René Lariche, who said, "There's no pain that's so easy to bear as that of someone else." All right. Think about that for a minute, all those who are listening to this podcast. So we can learn from that. And we have to accept the patient's pain. Are there patients who exaggerate their pain either consciously or unconsciously? Absolutely. But we can't assume that. And our first response has to be, this is real pain. And I will tell caregivers that the expression of your care and the recognition by saying, I really understand how much pain. Now, that requires a little bit of doing, to be honest, okay? But just watching the patient and the struggle they have and try to understand and then translate what you've just learned and say, I understand how much pain you're having. And then the encouragement. But I'm here to help you, and I'm here to help you connect with your professional caregivers and translate your discomfort and help you translate your discomfort to them. There's a lot more. I mean, there's certain real keys about what patients could do for their own arthritis, and I'll get back to the caregivers in a second. I mean, being active is extremely important, and we'll get back to that as we go along. Staying active, exercising, trying to, on the one hand, recognize how much discomfort, yes, you have, but try not to let it get you down. That's hard to do. I'm not saying you can't, but on the other hand, you don't want to surrender to your disease and say, regardless what kind of arthritis you have, oh, I'm going to have pain the rest of my life. I'm going to be in bed the rest of my life. No to all of that. Mind over matter. We all know the expression, and somebody is listening and say, oh, it's all right for you to say, Dr. Katz. Well, I can tell you, I've been a patient myself. All right. And I have applied to myself the same things that I've taught my patients, and very fortunately, and thank God, that has tremendously helped me and maybe even cured me. And by the way, I have arthritis too, and I have osteoarthritis, and I have osteoarthritis all over my body. Okay, and in my neck, my spine, my knees, my hands, and I'm managing. I'm active. I'm doing the things that I want to do every single day.
And you look marvelous.
What?
I said, and you look marvelous.
Thank you.
Interested in learning more about the Impactful Caregiving Affiliate Program? Reach out, connect at impactfulcaregiving.com.
So what is your legacy?
My legacy is more to my family, and to that extent, and you know this already, I am writing my memoir, and there are some people who would say, "Oh, you're writing your memoir because it's an ego trip." It's turned out to be it was never an ego trip for me. It just happened because I've learned that another family member of mine, much older, was writing their memoir, and I said, "That's really terrific," because I know so little about my family, and I said, for those who want to read it, let them read it. And then as I got into it, I said, "Boy, there's a lot here in terms of passing on to my family my belief systems." Okay. Some of the things we've talked about, the need to be compassionate, the need to connect with other people. One of the things that I do now, and they don't have to read my memoirs, my grandson is 17 years old, and I've been taking him out to breakfast and then to school ever since he's 1.5 years old. Well, he wasn't going to school then, but eventually he went to nursery school. And I've been doing that for 17 straight years, and now his sister is 14. So I'm passing that as a legacy of caring. And you know what? If I would seem to forget they would be in touch with me. Just want to make sure we're going out on Friday morning because
I
it's
love it.
far more important to them at this point that it is. And my grandson said this, you're not going to believe this. And somebody is saying, well, what's Dr. Katz talking about? Well, it all relates to the peopleness, whether it's your family or others, and the connections and how you can help other people with their feelings and feeling good about themselves, which translates to feeling better. So my grandson said to my wife, he said, not only when I have children and grandchildren, am I going to be doing the same thing, they call me Poppy, as Poppy's going to be going, but we're going to invite him to come along with us.
That is beautiful.
Right.
That's beautiful.
I think that what, I don't know if it's the right term or not, but that's what we've been calling it, the non-pharmacologic, and let's be specific, the psychologic aspects of arthritis in all forms, despite the technology that I talked about before, is going to be more important than ever before. And if I can pass that along, I'll have considered it to be a good day and a good life.
Absolutely. Absolutely. So, with the pressures that young people are facing today, what do you find are the matters of your grandchildren's heart when you meet with them weekly? What's first and foremost on their minds, and how do you insert, and craft their outlook and perspective?
Yeah. Well, I will tell you that so there are two of my grandchildren, and I actually have a total of 9 grandchildren, and each of them is quite different, but each of them shares the value system that we are talking about, because my wife and I passed it down to our children, and they fortunately, and I do want to underscore, fortunately have passed it down to their children. Very different, but they do share, all of them in very, very different ways, this value system of not only how they take care of themselves, but how they can take care of other people. So all my grandchildren, except 2 5-year-old twins, okay, they're not there yet, okay, but whatever field they're in, I have a grandson who's an attorney. I have 2 of them are in real estate. They're all in different areas. But on the other hand, they have really become successful people persons. Okay, that's very important. My son is also in commercial real estate. And there's a lot of smarts involved in knowing the business, but his personality for him is the secret of his success, and is caring for other people. I've heard him even on the phone with his employees, and I'm saying, wow, he handles his employees just terrific, with such respect, but on the other hand, with firmness and educating them in every conversation that he has.
Absolutely. Yes. I think it's all legacy, because it not only crafts their character as human beings, as you said, but it also determines their behavior in a professional space. And I think it is an acknowledgement that our personal and professional lives intersect in that matter, and impose themselves onto our workspace and conduct. So I think that's so brilliant and important. It's important work that you're doing, both professionally and personally, for the legacy that you carry.
Well,
So
thank you for that. But can I, Kipling, before you say what you're going to say, you mentioned one word that I have not mentioned before that is so key and central to everything that I currently believe, and that's character. And character can be defined in different ways, but it is a certain degree of self-awareness of other people, and also the willingness to make sacrifices of different kinds for other people at your own expense sometimes. And if you can do that, okay, that really makes you a fine individual. And there's some people, I've had this discussion before with others, and some say, well, you are who you are. You can't teach character. I disagree. I think you can. I think, yeah, basically personality is very developed by the time at least they're in their teens and 20s, but you can improve it by teaching hints on character and making some and demonstrating how you can make sacrifices. You agree?
absolutely. And more so, you know, what you have taught me is the giving of your time. Like even for now, for you to say, yes, I'll sit with you, I will be a part of your podcast, is tremendous. That I'm sitting with a world-renowned rheumatologist who happens to be a significant mentor in my life, who said, yeah, I'm going to give you some of my time. And so that does pass on. Like last week, I lectured in rheumatology. There was a woman who said, I know you must be so busy, but I would be so happy and honored if you would be willing to mentor me. And frankly, yes, in the scheme of time and tasks, it is a sacrifice, but I would dishonor myself and those who have taken the time to pour into me to not do that for her. And I think that is the whole schematic of everything of what you're saying, in terms of, yes, you have spoken to your personal sentiment in terms of the legacy that you're leaving your family and the time that you're investing in your grandchildren and children. But it's all relevant. It's all important. And it does bear witness to the care we give to the patients we serve. So, wow, I love myself some Dr. Katz.
And I love you too, Kipling.
Any final notes? Any final notes for our audience?
The only final note is that arthritis is not a disease that I take for granted. The overwhelming majority of people, and we have an aging population, the overwhelming majority of people are going to get arthritis, and arthritis can be painful. But I want to be, again, extremely positive, and that it's a hurdle, but it's a hurdle that you can go over, around, or through. But you can make the necessary adjustments. I will end with just a quick anecdote. I had a second cousin who was my patient, and she was 100 years old. And one day, and she had arthritis. Obviously, that's why she was seeing me. And she goes right through my waiting room and is waiting for me outside the exam room. And as soon as I opened the door, she said, Warren, 100 years old now. Warren, don't keep me waiting. I have too much to do. I have a bridge game at 4 o'clock today, but before then, I have to go shopping for some new clothes and get some food. I said, come right on in. I mean, 100 years old, and she wound up dying at 105. Isn't that a blessing?
Wow. Yeah. Wow. That is.
Attitude.
Absolutely. Mind over matter.
Yep.
Well, thank you so much for sitting with us at the CarePOD today, and I'm sure that our interview will bless so many.
I hope so, and thank you for inviting me, and hopefully we can do this again, Kipling.
Absolutely, absolutely.
Welcome to CarePOD, a safe place to educate, inspire, and renew the caregiver. Listen in with our host, Dr. Kipley Bell, as she interviews different experts along the caregiving journey.